My name is Dr. Marisol Arcila-Moon, and this is Dr. Cheryl Trudy. I'm from New Moon Regenerative Medicine. Dr. Trudy has a practice called Balanced Physician Care, and we're here to talk to you about some alternative treatments in back pain that can help you get your function back and reduce the amount of medications you have to take, and hopefully get you back doing the things you love. And so, I'd like to just start and talk a little bit about, back pain is so common. It's one of the most common reasons people miss work. It's one of the most common healthcare costs that are involved with lots of patients, and the majority of patients will have back pain in their life. And so traditionally, we have certain algorithms that we've been taught. Physicians have, athletic trainers have, even as lay people, and we read about all these types of things that we do to help for injuries. And so what we try to do is take a step back and kind of see what are the things that we can do that are more natural that can help heal our pain. Okay.
Yeah, absolutely. Dr. Cheryl Trudy again with Balanced Physician Care, and Dr. Moon and I both have training and expertise in the sports medicine world, and a lot of our conversations sometimes have revolved around, maybe we need to relook and to rethink, how we approach things, because there's some emerging literature that, supports the fact that maybe we need to look at what we traditionally recommend and, alter that and take a look at it. And so I know a lot of what you do. I do a holistic medicine as well as sports medicine, so I'm going to talk, second here a little bit about maybe more global inflammatory issues. But I know specifically when it comes to a new injury, there can be maybe we need to relook at what we do, right?
So basically, what my background is I've been doing pain management for the past 10 years almost. And so I have that outlook of the treatments that we traditionally would do, which an injury would happen. So an acute injury, any type of acute injury, what we normally have been taught is we rest it, we ice, we do compression, elevation, and we take anti-inflammatories to decrease inflammation. In the pain world, we medicate with medications, sometimes strong medications, as well as we do lots of injections, steroid injections, which decrease the inflammation that's there and temporarily help for the pain. But in the long run, we know steroids in general are not the greatest thing that we should be doing to our bodies. We know people that have chronic steroid use, regardless of the method of how they take it, but we know for sure those that take it by mouth have significant health issues with osteoporosis, with weight gain, with weakened ligaments, tendons, and bones, where they're more prone to fractures and things like that. And so what I'd like to discuss a little bit is about alternative and new treatments that actually are not new treatments, but maybe new to you, that discuss a little bit about ways to help an acute injury hopefully not become a chronic injury. And so when we approach these things, when you have an acute injury, whether it's your back or whether it's an ankle or whether you sprain a joint or things like that, you usually will get swelling that's there, and that's inflammation. And we've been taught sometimes that inflammation is a bad thing. Well, not exactly. So in an acute injury, inflammation is what heals you. Inflammation is what brings in the growth factors to say, hey, something's not right here, come and fix it. And we've been traditionally taught, hey, let's decrease that inflammation because that brings on pain. And that's maybe not necessarily the best thing to do when it's a new injury. Because you may be dampening, even though it may feel better, you may be dampening the healing factors that actually come in to heal it in the long run. And as we know, as we get older, we don't heal as well. As a kid, bounce back really quickly. As a teenager, we still bounce back, but sometimes as a teenager, college student, getting into our 20s and 30s, when we sprain that ankle, when we hurt that back, and we don't let it heal properly, that becomes a chronic injury. And then we're starting to panic and seek how do we fix that? How do we do that? And so I still am a proponent of physical therapy, getting your muscles in the best shape that it can be. But if there's a problem or strain in those ligaments or tendons, physical therapy only helps so much. It only helps for the muscles. And so some of the treatments that I offer for low back pain and ligament issues and things like that try to help rebuild that ligament and strengthen that ligament. And some of those treatments are called prolotherapy, or a bigger term is regenerative medicine. But prolotherapy, or PRP, which is your own platelets, can help strengthen those areas if we can get a good inflammatory response there. You have anything to add?
No, and I'll go into that a little bit more, but when specifically, with soft tissue treatments, that's definitely what we soft tissue problems. A low back strain from a ligament, or from maybe a muscle that's been strained, and maybe even to some extent that might apply to disc disease as well. So Dr. Moon is kind of talking about how there might be some novel ways at which we want to look at inflammation when it comes to back injury, because like you said, traditionally we've just pretty much focused on doing these kinds of things to dampen the inflammatory response, and then follow that up with obviously strength work. But maybe we need to relook at how the inflammatory response might actually help the healing process.
And let me just add a little bit more here about just the background, because I've have seen lots of low back pain, lots of neck pain, lots of people with car accidents and injuries, and we would commonly see patients that came in for acute injuries from accidents, and their imaging studies and MRIs are normal. A lot of the things that can cause pain may not show up on an MRI. The ligaments and muscles and tendons that may be affected, if they're not torn, will look normal on MRI, or if there's no fluid accumulation, would look normal on MRI. And what I would commonly see is that a patient would come in with back pain, would have signs of potentially a pinched nerve, or would sound like there was a bulging disc or a herniated disc, and the MRI would actually be normal. And we would re-image these patients, 6 months, a year down the road, because their pain would continue. And then all of a sudden now, over time, they developed a herniated disc. And so how do you explain that? So if you consider just an example as a whiplash injury, you have a high force velocity that stretches ligaments and tendons beyond its capacity that it's supposed to do. And so they may not tear, they may not rip, they may not show an injury that's there on an MRI scan, but the stretch is kind of like a rubber band. When you stretch it too much, it starts to lose its ability to hold things in place, and that's what holds our body in place, is tendons and ligaments. Without it, we'd be flopping on the floor, we wouldn't be able to stand up straight and things like that, and it's the cause of a lot of medical issues and things like that. And so when you have a disruption of the stability factor that's there, consider like a door that's on a hinge that's not correctly on there. Once that wear and tear gets there, that's where you start to get the instability, and the discs are not stabilized as well, so then they start to shift and they start to outpouch, and then that's where you get the disc problem, or arthritis in other joints, because the joints are not stabilized so well. And that's what keeps those joints stable is your tendons and ligaments. The muscles, that's not the job to do. If you're, a lot of times you'll get muscle aches and pains because the ligaments and tendons are not doing the job that it's meant to, and the muscles are having to take over and do a lot of that extra work. And many times physicians don't address those issues because they don't have an option for you to do other than treating the secondary problems. And so we end up sometimes more focusing on those secondary issues than trying to treat the primary problem, and then those other issues usually go away when the stability gets better. Similarly, how we were talking about inflammation, so if we can get that inflammation to actually do its job to heal in the acute phase, then hopefully down the road those ligaments are still have their good strength and will do its job. And then over time that inflammation hopefully is not there anymore, and chronic wise you don't have to deal with chronic inflammation.
Yeah, absolutely. And there's we think that there's a difference. Here what we're talking mostly is targeted and localized inflammation. And so, when it comes to injury and soft tissue injury, we're talking about acute inflammation, and maybe it might be subacute in the sense that you have some kind of a muscle strain and that weakens it, and then you go out and do another activity 3 months later, and then that strains it again. We still kind of might consider that like an acute inflammation, because it's sort of a injury of a tissue that's already weak, as opposed to more chronic inflammation, and that's something that I think a lot of people have heard about in the context of a lot of chronic diseases. Certainly diabetes and heart disease, we are now starting to throw out terms like the body has chronic inflammation, and so I'll talk to that a little bit as we kind of move into our next segment. But I think it's that targeted inflammation that we need to look at as now a different entity, and that maybe that's really an important component of the healing process. And those anti-inflammatories that are great for pain, but may actually be hurting us because they're suppressing that inflammatory response that we need.
Mm-hmm. So. And then just to talk about, a lot of times traditionally when pain management and the injections and steroid injections stop working, what is usually the next step? And a lot of times they send you to surgery, right? And so how many times or how many people have we come across, or family, friends, even patients that have surgery to fix the disc or to fuse the joints, and they still have continued pain. A lot of disruption happens in surgery. Now, I'm not saying surgery isn't necessary, but there are a lot of things that we need to really think about before we jump to surgery. It should be the absolute last resort, because think about it, it's disrupting not just where the problem is, where hopefully they think they're fixing the issue, but when we step back a little bit and say, well, how did that happen? Part of it comes back to the stability and the issues that are there that might have been resolved if the ligaments and tendons were treated. And so when someone goes in to have a discectomy, or a 1-level fusion or a 2-level fusion, a lot of times that surgeon or that physician that talks to you about the surgery may kind of tell you, well, down the road, we may have to do a level higher, or we'll have to see how you're doing to see if any other further surgeries are needed, because it disrupts the normal anatomy that's there. And with the fusion, it's meant to try to keep those joints and the spine aligned. And now the segments that are above and below that area are taking much more stress and much more wear and tear that it wasn't necessarily meant to. And so now you're looking at, are those areas becoming involved in where your pain pattern is? And so we come, especially in my practice before, we would get a lot of patients that had surgeries, and we'd call them failed surgeries or failed back surgery, and you'd ask them, what did it help with? Well, it helped for this, but I still have back pain, and I still have the muscle aches and pains, and now I have this type of pain. And so it unfortunately was a bit of a never-ending story. And we all go into the intentions of trying to do what's best for our patients, and what we think is best for our patients. And sometimes if you don't know that there are other ways to do things, and potentially safer ways to do things, then you don't get that opportunity to know about these other treatments. And just a little more background is that the type of treatments that I'm talking about, like prolotherapy and PRP, are things that have been around actually for a very long time, and it was things that we're not actually taught in medical school. I was taught some of this in fellowship, where someone that had gone and done their own training had come back and talked to us about this. And, it kind of stuck in my head for a long, long time, and I hadn't practiced it for a while when I was in the traditional pain practice, and really, started to come across patients where it started to click of, why are these patients not getting better? And the patients in fellowship that we treated with prolotherapy were all sorts of patients with low back pain. It was those that didn't want to do injections, those that had failed the steroid injections, those that had surgeries and failed surgeries. And the majority of them, were coming back to do these procedures because it was the one and only thing that gave them back, honestly gave them back their life, they said. And so, even those that have had surgeries to their back were feeling much better with these treatments because they were getting stability back there that they hadn't had. And so, it's important to get people to know more about these types of treatments so that they can inform themselves of, surgery is not the only answer, steroid injections are not the only answer, narcotic medications are not the only answer. And, we're in a society that's trying to do better for our bodies with better nutrition and better things that we're doing overall for our skin, for what we eat, what we ingest. And I think we're becoming smarter in that we're realizing that, those are the things that we need to do as a preventative care instead of letting things kind of go past it and then trying to backtrack.
I think it talks to, again, that holistic approach. I think it's something that probably maybe needs, it's being brought to other parts of medicine, but I think it needs to maybe be brought to sports medicine and to musculoskeletal medicine a little bit more. It's not in healing any type of injury. It's a multi dynamic approach. I would always caution you to be very weary of any physician that would tell you that there's just one treatment and that will cure anything, because we know that with any type of an injury, there's going to be phases of your healing, and there's going to be many things that you want to take into account. Like you said, even if you're a good surgical candidate and there's something there that has been shown to be helpful, surgery in and of itself is probably not going to fix everything, like you said. So it's important to realize that, yes, this will fix a certain portion, but I'm also going to need to also be working on everything else around that post-surgical time period, or maybe even pre-surgically to some extent as well. And so you really want to kind of be mindful of that and have a physician that will map out that plan. And so sometimes maybe seeing a provider like yourself or me who may take kind of a broader approach and look at it a different way might be worth doing, in addition to maybe seeing a surgeon or something like that, to maybe map out maybe a larger plan that tends to make sense. Because like you said, it's not just about one particular modality fixing it, but it's about a whole program to bring you back to what you want to be able to do.
All right. And so and keeping strong, keeping healthy is obviously one of the best things to do. And Dr. Trudy and I are here to try to help bring light to some of those things that we can offer in our practice. And hopefully you all have learned a little bit more about some of the things that we do. Let me see if there's anything else on my list that I wanted to cover, but just to kind of recap a little bit, we talked about in acute injury, we were commonly taught about RICE, rest, ice, compression, elevation. And so I'm proposing a new kind of thing I did not invent. It's something else that, that other prolotherapists and regenerative medicine physicians talk about. It's called MEAT. So it's movement. So you want to continually move that joint. So whether it's passive movement, things like that, you want to not necessarily immobilize the joints. Exercise, so keeping the muscles strong. Analgesics, so not necessarily like narcotic medications, but to avoid the anti-inflammatory medicines. Tylenol has helped, but does not decrease the inflammatory response, but is a mild pain reliever. And then treatment, so whether that's physical therapy, ultrasound, heat, massage, prolotherapy or PRP or things like that. And a lot of that can help get you back back better from your injury, sooner from your injury, and hopefully not have problems with a chronic injury. And lastly, you know, when we talk about arthritis in general, you know, arthritis is not just an aging thing. It's not, you know, it's not because you get older you get arthritis. A lot of times it is because there's an instability that's there. And so if we keep ourselves healthy, keep ourselves strong, and try to avoid these anti-inflammatories or acute injuries, if we keep those joints all stabilized, then we can avoid arthritis as we age. So.
Absolutely, absolutely. So, you know, I'm going to kind of move into a little bit of our second phase here, where I'm just going to kind of maybe go over a few things that Dr. Moon has talked about, and then, you know, kind of maybe talk a little bit about some of the more herbals and non-traditional modalities to, again, have a more holistic approach to low back pain or any kind of musculoskeletal issue, and then maybe talk briefly about acute versus chronic inflammation, and what are some of the differences with that, and what are some of the different approaches to chronic inflammation. So, you know, getting back to, you know, low back pain, you know, most of the time there's two main categories that we touch on, and that's soft tissue pain. So we talked a lot about ligaments and muscles, and to some extent maybe even disc issues, but then there's nerve pain, and most of us recognizes nerve pain as being sort of maybe a slightly different entity, you know, because when the nerve is compressed, its type of pain tends to be just a little bit different. And so, like you said, I mean, traditionally, if you go to, you know, any physician, they're going to talk about, you know, taking an anti-inflammatory, maybe injecting local steroids. Those are all very traditional treatments. But, you know, we also use things like muscle relaxers and manual therapy. So those things as well have been used. And sometimes those maybe fall to the background because, you know, it's just so easy to get an anti-inflammatory pill. It's so inexpensive, and, you know, sort of what we've been taught, you know.
True.
Yeah. And so the question is, well, is inflammation good or is it bad? Well, the problem is it's never a black and white answer,
True.
right?
Right.
You know, if only it could be, you know, we could all kind of treat ourselves, but it's not. And so, you know, the feeling is that there's maybe a difference between temporary, you know, inflammation and global inflammation. And that's a lot what Dr. Moon, you know, pretty much was talking about. And so there's a feeling that temporary, targeted, local inflammation is important for the body. I mean, it's the body's own innate healing process. And to some extent, if we're cutting that off, then we're cutting off the body's ability to heal itself. Versus global inflammation and chronic inflammation that's been going on for a really long time. You know, the body is set so that inflammation is supposed to kind of have this bell curve. You know, it shoots up, it starts, it peaks, and then it sort of works its way down as the tissue heals. But if there's sort of this chronic inflammatory response going on, it begins to create changes, you know, in hormones and tissues and nerve signaling that then may be creating things in our body that we don't want for the long run. So again, that's when we're talking about inflammation, we're talking about a new look at that neat sort of, you know, way of looking at things. It's looking, again, saying that is, you know, something for more targeted, you know, local inflammation, and versus, you know, something that's maybe more global, associated with a global chronic disease. And so like prolotherapy and a lot of the regenerative medicine that Dr. Moon does, acupuncture is actually another way of trying to bring about a targeted inflammatory response. And, you know, most people, there's a lot of different ways that we think acupuncture works, but we think that dry needling, which is another term that often gets thrown around with acupuncture, is basically just taking a needle and inducing an inflammatory response. you know, it has a lot of great evidence, especially for like chronic tendinopathies and things like that, that it may help with. So again, we're seeing that this targeted inflammation may actually be helpful. And so, you know, if we go to global inflammation, so, you know, what is that, and what is that about? And so, you know, global inflammation, like I said, is something separate, and we think that more has to do with a chronic type of a problem. And maybe, you know, at some point, a lot of people who are having chronic back pain, you know, it begins to move from maybe something more acute into something more chronic. But also when we talk about a lot of chronic diseases, like, you know, a joint inflammatory condition that's chronic, such as gout or rheumatoid arthritis, you know, these are more chronic inflammatory issues, and so perhaps looking and addressing that, but there's a different way of addressing it. It's not, you know, taking just an anti-inflammatory pill on a regular basis for a chronic inflammation disease. It's looking at nutritional factors and then diet factors to see if you can make a difference in that sort of global inflammation. So, you know, one of the things that, you know, I talk about a lot to my patients, and to, you know, we've host several workshops on this, so you can always, you know, look out for something like this in the future, is talk a lot about the anti-inflammatory diet, and it goes by another name, the Mediterranean diet, and there's a lot of population-based studies that the people who eat this dietary pattern have less chronic inflammation, and we measure chronic inflammation by certain blood markers that can kind of give us an idea if there's been chronic inflammation there. So I'm going to take a sip of water here for a second. But that's, you know, one of the things that, you know, really works for chronic inflammation. But another thing, you know, that helps to reduce some global inflammatory there's a couple of herbs. So I carry a product line at my office called Orthomolecular Products, and I like these because this is really, in my mind, a pharmaceutical grade supplement. So while you don't have to get it from a pharmacy, their standards of quality, purity, and their sourcing from beginning to where they actually, you know, pick the plants and to purify them and to encapsulate them are tremendous. And so, and they've done a lot of studies on making sure that what we want to get delivered to the tissue actually gets delivered. So I particularly have been impressed with how quality and good these are, so I sell these particular ones. But, you know, so fish oil, a lot of people have heard about it, a lot of people, you know, have heard about it around their heart, but in general, it's a great for chronic inflammation. It's fantastic. And why is it? Without going into a lot of technical issues, we know that it's a fatty acid, and it's high in a particular type of omega-3 fatty acid, which is DHA. I'm not going to say the big name because nobody ever remembers the big name, but if you ever Google DHA fatty acid, you know, we believe that having a lot more of that in our body helps to reduce these chronic inflammatory factors. And so it's difficult. You can get it through a diet source, but it has to be a cold water fish source like salmon, herring, or sardines, and a lot of people don't tend to eat that a lot, so then a lot of people look towards supplements. And if you do look towards that, again, you want to try to find a high quality supplement. But again, incorporating more DHA in particular into your diet on a regular basis can decrease global inflammation. And I've seen it a lot of times just help people who may have more of a chronic musculoskeletal inflammatory process where a lot of joints are bothering them at the same time, or in the case of a chronic back pain. you know. So while it is anti-inflammatory, it's not hitting sort of that healing response that we want. It's kind of getting at that global inflammation. Another one that I really like for inflammation is turmeric. You have to, if you're going to use turmeric though for inflammation in the joints and in the soft tissue, it has to be taken along with some peppers and with food in order to be better absorbed. So if you're going to try that, you know, you can certainly try the spice. A lot of people do. Some people don't find that palatable to be taking, you know, a tablespoon of that every day. It can be a lot. It's great if you cook curry a lot. You probably get enough of it in there. But this is also, again, another great, and we think that it affects inflammation in such a way that it kind of keeps it balanced without necessarily dampening the good inflammation that we want. So, you know, again, if you're looking for alternatives, while this is certainly not going to be like taking, you know, a pain pill and give you immediate relief, you know, but with taking this over an extended period of time, you know, particularly the fish oil and the turmeric, and also in here is bromelain, which is another really good plant for it. What you'll notice over a few months' time is that you're less achy. That those numbers, instead of being, you know, consistently a 7 out of 10 pain if you're dealing with chronic pain, that they're probably going to fall, you know, a little bit to, you know, maybe a 4 or a 5. And maybe that might not seem like a much, but, you know, for anyone who's dealing with that, to have a little bit less, it does make a difference. So, you know, those are kind of some great things to help out, again, with that soft tissue or any of your chronic, you know, inflammatory disorders. You know, we talked, so that's a little bit about soft tissue, but then we have nerve pain, you know. So we talked maybe a little bit, and I don't know if you have any particular, you know, anything to speak about nerve pain, but it can definitely be a different type of pain, right?
Sure. So, you know, when we talk about nerve pain, there's an irritation to the nerve that's there. It can be from a few different things. Either the disc is actually touching, irritating the nerve, there's a compression that's at the nerve, or the disc is leaking out irritant to the nerve, or along the track that the nerve follows, that there is some compression along that way. And so, so it kind of stems back to, you know, where along that pathway is there a disruption there. And you can get nerve pain from severe muscle spasms. Imagine, I mean, the nerves go through muscles. If there's a spasm that's there, then you can get mimic of a pain that's a pinched nerve, and people will say, I got a bulging disc, or I got sciatica. Well, you know, as a physician, we understand what you mean. You have pain down your leg, but a lot of times it may not necessarily be, you know, from that bulging disc or things like that. And so, kind of stemming back to stability-wise, you know, if we can prevent that disc from bulging, which would be trying to stabilize that area, then usually those sciatica nerve pains go away. Now, what do you do if that problem is already there, right? If we already have an issue that's there, well, for one, as a physician, you need to make sure that that's really the cause of where the pain's coming from, because they've actually done studies that show for patients over the age, I want to say over the age of 40 is the study, and with CT scans they did, and these were asymptomatic patients. These patients did not have any low back pain whatsoever, but over 50% had abnormal findings in their MRI. And so what does that lead us to think? Well, you know, we don't always, and we shouldn't always treat by what we see on an MRI. We need to do a good physical exam and then correlate and see if what on an MRI is actually something that fits the story. Because a lot of times we'll jump to conclusions, and you know, I will admit that in times of when you're busy in clinic or things like that, that you may, you know, just look at an MRI and not re-examine the patient, and you know, you want to see if those are correlations that are there. And a lot of times we rely too much on imaging studies, on MRIs, to say, okay, that's the bulging disc. Oh, you got to get that disc taken care of. Well, it's not exactly the whole story that's there. There's a reason why that the disc is bulging, and now is that bulging disc causing nerve pain. And so, there are multiple treatments for that. And in the pain world, it was, you know, the injections, nerve pain medications, and really, if it got bad enough and it was debilitating, then we would send you to that surgeon. And so, medication wise, as we look back at this, the grand scheme of things, unfortunately, not everybody can do certain of these treatments, and we have to deal with what's in the capacity of our patients to be able to do. Some are not good surgical candidates, whether they wanted to go to surgery or not, they're just not. And so you have to come with a plan of what's hopefully in the best in the interest of the patient, and see what we can do with what other health factors are there and what would be healthy for you to do and how you would respond to some of these treatments. And so there's lots of different neuropathic pain medications that are out there, muscle relaxants if it's due to spasms that are causing nerve pain. But a lot of this we can get down to it by doing a good physical exam, because sometimes this pain can be reproducible upon pressure or palpation, and that doesn't necessarily mean that, hey, that problem is coming from the disc. It could be that that's coming from the muscle or coming from a peripheral part of the body in terms of the limb and things like that that's causing the pain. And so you don't necessarily want to be undergoing treatments and aggressive treatments and surgical treatments if it's not thought that that's really going to help the cause of the pain. And so you have to look at the grand scheme of what is best for you to do at the time of the problem that's there. And hopefully there are some things and more conservative things that can be done to help reverse some of those problems, and then hopefully the nerve pain and those other aches and pains kind of go away. So
yeah. I mean, when we deal with nerve pain, we often, there's some medicines and there's categories of medicines, but typically there are what I call nerve modulator medicines. Gabapentin and Lyrica are commonly used. But we're not exactly sure the exact mechanism. We believe that it is stabilizing the membrane, but we're not exactly sure. A lot of those. Another one is Elavil or tricyclic antidepressants, and yes, a lot of patients will feel better when they take those, but there also is effects globally throughout the body, and so sometimes I have hesitancy in using that because there are issues that can be affecting the body in other ways. So I try to use those if I can sparingly and for a limited amount of time. And I think that goes back to, like you said, if there is a nerve pain, and perhaps like you said, it's a structural issue, whether it's the muscle spasming around the nerve or if it's the disc. I mean, the body has tremendous ability to heal. When a disc gets herniated, that material gets eventually taken back up by the body. And so I think it says what you say, is there something that we can do to restore normal structure and then normal function without surgery? Because that's a permanent fix that we have sort of created that we believe is going to be the best thing. But if there's a way, like you said, to maybe use PRP to introduce stabilization and take pressure off a nerve, we're going to be able to make a difference. So I think, again, is trying to restore the body to its previous, structure and then hence function goes a long way. Another thing that's often used for nerve pain are TENS units, and they're really it's using signaling, to try to change the perception of pain. And a lot of people will use that on a regular basis, and that's a lot what acupuncture does too. To circle back around how acupuncture can really be a great help is again a way of helping nerve pain without using a medication that's going to affect you globally. And so maybe for some people it might be great temporarily till they can get a chance to do something more with the structure and rebuild with physical therapy. But for some people, it might be something that they just do on a regular basis because it kind of helps to keep them any issues at bay and keep them active in what they want to do. And so that's really what a lot of Western studies showing what acupuncture does is, besides locally helping to regenerate soft tissue, with targeted inflammation, it can also help to calm or quiet the nerve response, and we think it does that by promoting the inhibitory nerves of the body. It's kind of, tends to have a little bit of a dichotomy there, but that's the way we believe that acupuncture hurts, it works. And, I think, I'll take a second to just, a lot of people are very nervous about needling, I think, but, when it comes to, acupuncture, we use really thin, very, very small needles. So I would say 95% of people who get acupuncture done by me are really surprised at how little it hurts. We've always got a few people who are very sensitive and, they'll feel that it's not right for them. But for the most part, most patients say that it's a very relaxing experience, and they don't feel it much at all, which is why we do a lot of introductory new patient specials, just so that people can say, hey, let me give this a try. It's not going to be much up front, and see if this might be a good option for me, whether by itself, but often I encourage it in conjunction with other things, because like we talked about, a holistic kind of approach with a lot of different modalities seems to work well. Just to transition sort of to my last point here as we're wrapping up is, we talked a lot about the nervous system, but part of the nervous system is the brain. We forget that, it's up here at the end, but it's all connected, and in the body it is. And a lot of times, I think people discount our brain's effect on pain. Stress, our emotions, our perception of what's going on. There are lots of studies that show that those things affect our pain. So you'll see in the world of chronic pain a lot of use of prescription medications like serotonin reuptake inhibitors, SSRIs, and things like that, in an attempt to try to tap into this effect that's happening. But I think there are a lot of other powerful tools. They sometimes take a little more work, but the great part is a lot of them can be somewhat cost free. So really taking a look, if you have chronic low back pain or you're dealing with low back pain, really ask yourself, to what extent is stress in my life, affecting this pain? And, if you can say to yourself, well, yes, it is, and definitely to a significant amount, then maybe ask yourself, is there just one thing that I can do to try to help with that? And for some people, they'll do a lot of manual therapy by another provider. And so what I'll say manual therapy is maybe they'll get massage, or they'll do something like that to sort of, help, with that stress, because while the soft massage helps the soft tissue, it also, can kind of help the stress. But there's things like, meditation, mindfulness, visualization. And, those practices are sometimes not very easy to get into the habit to, but once you do, I think a lot of people can find that is extremely, helpful for pain. So, there are a lot of websites, and there are a lot of, apps nowadays that even if you don't have access to be able to, see a yoga practitioner or go to a class, there are a lot of things that you can maybe try on your own. So I encourage you, to kind of take a look at that. So, in summary, sort of with my part, we talked a little bit about targeted inflammation and how that actually probably is helpful, and maybe we need to relook at anything that might decrease that response, because maybe that is actually the response that we want, is that targeted inflammation, and to relook at what we use when we reach for something from the medicine cabinet, maybe something like Tylenol, or a muscle cream, or something like that instead. you know, and that there's a little bit, and that something like dry needling or a lot of the procedures you do, you know, which again, prolotherapy.
Yeah. So prolotherapy and PRP, they're along the same spectrums of trying to strengthen the ligaments and tendons to hold the stability that's there. And so with prolotherapy, majority of patients will have to have at least 4 to 6 sessions usually to have the best difference. And so what we're doing is trying to invoke the response of your body to send the healing factors and growth factors to that area to tighten those ligaments and joints up so that you can prevent, you know, the muscle aches and pains and things like that. And so, you know, it does involve a needle. There is numbing medication that's involved with that too. But the whole point is to really signal your body to send repair signals there. And so that inflammation is considered the good inflammation. You know, it's something that I offer in my clinic, as well as you know, we would discuss whether prolotherapy would be better or PRP, and it's just a different spectrum of response that's there, and you know, an evaluation of you know, is it the ligament problem, is it a muscle issue, is it really the disc that's giving a problem? If you know, if we can get some of that more stabilized, will all the other stuff feel better? And that's kind of the point that I want to get across, is that, you know, I want my patients to feel better, and I want to do it the least intrusive and least harsh way in terms of other man-made stuff that we're putting in our body. And you know, and if you're tuning in or you're listening to this, you're motivated patients. You're patients that are looking for answers, looking for different things. You've probably tried a lot of the traditional ways, and so, you know, giving either Dr. Trudy or I a call to see if there are options that we have that you might not have tried can help hopefully get you back on the right track and get you doing much better.
Yeah, you know, and from what I offer, you know, at my practice at Balanced Physician Care, you know, again, like you said, looking at where you've been, what you've tried, and maybe seeing if we need to look at this from more of a holistic perspective from all that's been going on. You know, help inducing targeted inflammation, maybe through acupuncture, might be, you know, something to look at. Certainly, if you know, acupuncture doesn't seem to be powerful enough, you know, moving to something like Dr. Moon does. You know, looking at, okay, is there chronic inflammation going on in the body, and is that, you know, contributing overall, and, you know, what are some natural treatments that we can do to try to help, you know, reduce that global inflammation, and whether that's diet, supplementation, and again, good quality supplements go a long way. And then, you know, looking at the mind-body interaction. Sometimes, you know, just being able to sit and talk through it with somebody to be able to see and find a type of treatment that works really well for you can be very beneficial. So, you know, for both of us, you know, getting an accurate diagnosis is always important. Mm-hmm. So, you know, doing a real good, thorough evaluation and seeing what studies you have done and what you may need to have done. But then from there, maybe offering a different perspective. So, well, thank you very much for joining us today. Please, if you have any questions for either of us, for me, my practice is called Balanced Physician Care. I'm located in Ponte Vedra. The telephone number is 904-930-4774. And the practice email is membership@balancedphysiciancare.com. That's membership@balancedphysiciancare.com. And our website also is balancedphysiciancare.com, where you can find more about the practice. And then you, Dr. Moon?
And I'm located in the same office too, so convenience for you all out there.
Yeah.
And my practice is called New Moon Regenerative Medicine. My phone number is 904-580-6777. And you can reach me there, as well as the email is newmoonprp, so NUMOON PRP newmoonprp@gmail.com, and then the website is also newmoonprp.com. So if you have any questions, feel free to email. We usually personally answer those things. So we want to try to offer these treatments to you and to get you back to your road to recovery.
Yeah, and please, if you liked what you heard today, please pass it along on Facebook and Twitter, and look out for some upcoming events and workshops that we'll continue to put together, because we really want to get that word out in the community on how to make you feel your best.
Yep. And give us a like on Facebook.
Yes.